We're going to talk about health right now, the Health and Wellness Expo at the Albany College of Pharmacy and Health Sciences over in Albany. They're right across from the Albany Med Center, right next to law school. Can't miss it, plenty of parking. Tell us what's going to happen there.
Well, this is our second annual
Good
Health
for you,
and Wellness
yeah.
Expo. Yes, our co-sponsor is MVP. We have free health screenings, discounted flu shots, a nice balance between the screenings, wellness, some fun things.
Okay, good.
We start out with a 5K.
Run, oh yeah, and that was, I remember when he passed away.
6 years, yeah. So that's in honor of Mario Ziola. He was a faculty member and an alum as well, like you. It's a student-run expo, and Kathleen can speak a little bit about that.
And you're
as well.
a PharmD candidate? Yes. How cool is that? Oh, wait, what year do you graduate?
2016.
Oh, wonderful. Well, good. Congratulations for
you.
being sticking with it. It's a tough course, but it's so much, so rewarding, isn't it? How are you involved with this?
Yeah, I'm helping to plan it. So just to give you a little more information, some of the specific screenings we're going to have, the KEEP screening, so from the National Kidney Foundation, diabetes screenings.
How are you doing the diabetes? Is that a blood test or what?
I don't think they're actually doing the physical blood test just because of safety reasons, but they're giving you the information about it.
And what to look for.
Yeah.
Kind of that kind of a verbal screening. So
right, and then we're going to actually have a medication take-back day.
Oh, great.
Yeah, so we're going to have, we can take...
Don't flush them down
no,
the
don't
do
not flush them down the toilet.
Those poor fish.
So we're taking medication back. We can take controlled substances. The only thing we cannot take are sharps.
Okay, those are the needles.
No
in
needles
case
and sharps. Those can't come to us. We also are going to have nearby that, we're going to have pharmacists that if you have any questions, you can bring all your medications. They call it a brown bag event.
Brown bag, it's great. I participated in that. It's amazing how many people will bring in medications and you're taking both of these, and they well, this doctor prescribed this and that, and they're the same or they're doubling.
They're interacting with something else.
I mean, it's terrible.
There's also a farmer's market, discounted flu shots. You can just walk in and get your flu shot. It's early in the season, so you should probably do that when you can. So we're really excited. There's a nice balance between, like I said, the wellness. We have some Zumba and some yoga classes happening. We have a stage where we're going to have some people coming to do that. So we're excited about that. And we just want people there. We want to keep our community healthy. Our main goal really is to attract people who are either uninsured or underinsured, seniors certainly. Really anyone's welcome, but when we set out, that was our goal.
Your goal is to get it to the people who may not easily get to a physician.
Correct.
And not only that, I mean, if you don't have insurance, I mean, fortunately we have the Affordable Care Act coming up on October the 1st, which may alleviate some of this, but meanwhile we're still going to need these screenings, and we're still going to need tests that people can kind of screen themselves to see how if they've got the.
And it runs the gamut. It's not just people in poverty that are uninsured. It's people working full time or not. That
the working poor. I mean,
exactly.
You don't say poor, but the working.
So we encourage anyone, if you're, in the restaurant business and you may not have insurance, or you're a hairdresser and you work for yourself.
You don't have that,
so we really encourage people to come down and join us, because it's a great day. The kids put a lot of work.
Do the students work on this quite a bit?
Yes, you'll see a lot of volunteers there in bright red shirts. You'll definitely be able to get.
You get the faculty working on it too?
Definitely.
That's our push. We really like for the students, I should say, put the onus on them. It is a student-run event through APHA, ASP.
APHA
is the American Pharmacists Association, Academy of Student Pharmacists. I'm an advisor to that organization, so really I take a lead because I do plan events, but I'm really just on the sidelines.
You're on the side. You let them do the work on it. What are the hours of this?
Well, the 5K race is the first thing we're going to have. That starts at 9 a.m. And then the Health Expo itself is going to be from 10 o'clock in the morning to 3 o'clock in the afternoon.
Okay, so you've got an opportunity to
Yes,
get over there
definitely.
and check it out. And they can park on the campus because there's a law school and everything. And it'll be
Exactly.
on a Saturday, so the school won't be in session.
Right,
Right, it's
This-
this coming Saturday,
Yeah.
and there'll be lots of people directing people around if they need to find parking.
There'll be
Right.
event signage out on New Scotland, Holland Avenue. We'll also be using the Albany Medical Center parking lots.
Oh, good.
As well as Sage. They've been nice enough to offer that to us, so
So
as
you
well
should
as
have a
our
good
own.
crowd. Talking about the screenings, that we hear a lot about having a screening done. What happens when you get the screening done and it looks like you may have a problem? What do you do about that?
Well, we're hoping that people follow up with their healthcare provider. We want to be able to provide people with important information. Maybe they're in the beginning stages of a chronic illness, but we do encourage them. These are screenings, so we do encourage them, if they're able, to follow up with a healthcare provider, either at an urgent care or
Don't
some
use
other
the
vet.
ER, please.
Correct.
And this should be by no means be in replacement of going to see a doctor.
No, but it may
or
be
anything.
the only step that they'll take.
Exactly,
Correct.
and anything is
Yeah.
anything is a step in the right direction.
Yeah, and of course, a lot of people are kind of afraid to go because they're afraid they might get some news they don't want to hear, but we still have to face these things and try and do what we can, because many conditions are treatable if you catch them early enough.
We heard from many people that went through the KEEP screening, because that is an actual screening, kidney screening, that people found the beginnings of something that may turn
Kidney
into
disease,
something
yeah. Yeah.
later down the road. We heard from a lot of people that were very happy that they did that.
Well, see, and that's the thing, is until you do it, you don't realize how beneficial it is. We've been speaking with Patty Tompkins. She's the advisor and a student, which is really so nice to hear about a PharmD candidate coming in here. Kathleen Nicewitz, is this your first time on television?
It is.
It is. Oh, we didn't put you. We used to have a studio. Do they still have a studio at the college?
No.
Where we used to film them and kind of see how they present themselves. So,
Interesting.
yeah, that was a long time ago when I was on the faculty.
Yeah, but that's an interesting concept.
Yeah,
though.
yeah, we used to have it up there by the library there. But anyway, that's a whole, you excuse us while we chat a little bit here. Please, and the other thing I'd like to mention, that the Albany College of Pharmacy is not just for pharmacy, they also do health sciences. So if you're looking, and I think they have like 28 programs
We have a
now.
lot now.
Yeah, I mean, it's really, every time I hear there's a new program. And they also have a campus up in Burlington, Vermont. So please check it out if you're looking for a career change. This might be where you want to go.
Yep, and check out our website,
acphs.edu/health
.edu/health-expo.
You got it.
Hope you
Good.
stop in.
Stop by and say hi to them. They're doing a good job. Good.